Hi, this is an educational video about Alteplase Infusion. So if you have a hemodialysis treatment already in progress, but we're not able to get an adequate pump speed, so example, less than 200 mils per minute or constant machine alarming. So hopefully we've already eliminated the possibility of patient positioning or any of that kind of situation. And once we've consulted with the nephrologist, we make it an order for 4 milligrams in a 100 ml bag to run over an hour. So I've already mixed my Alteplase 4 milligrams in a 100 ml bag of normal saline. I have my Alaris pump set to go with the setting for Alteplase dialysis, which allows me this concentration over an hour. So I just have it on delay, ready to go. So first I'm going to start out by making sure I identify my return sides, because I need to run my Alteplase through the return side. So I'm going to get my sterile 4x4, put it under my line. I'm going to have non-sterile gloves on, of course, washing hands first. I'm going to do an outer scrub the hub of my return side, including my clamp and everywhere that I'm going to be touching. All right, hopefully that will stay. Okay. I also have a sterile 4x4 was soaked with 70% isopropyl alcohol, and I'm going to soak the end of my IV line and have it here ready to go. Okay, and I've prepped my sterile field in advance for the sake of the video. I have the chlorhexidine without alcohol swab, and I'm going to hold this up even though it's supposed to be sterile field. I have a Y connector that I'm going to be using to connect directly to my patient, and I have 2 of the pre-filled normal saline syringes. So of course I would open up my packages, let them fall, and then I wouldn't be touching with bare hands. Okay, so now I'm ready to get started. I've got my dialysis pump stopped, and I've got all my 4 clamps clamped on my bloodline. And I'm going to open up my sterile gloves, and I'm just going to start with 1 glove on my dominant hand, which I'm going to use to put my swab into my sterile field. Then I'm going to take my sterile towel and I'm going to put it under my line. Hopefully this will stay up on my pretend patient. Please stay up. All right, use your imagination. Okay, now I'm ready for my second glove. All right. Now I'm going to prime both sides of my line, the Y connector, with normal saline, making sure there's no bubbles left inside the line. Okay, prime both sides. Okay, now this is ready to go, and I'm going to take my swab, double check that I'm clamped. I'm going to do my scrub the hub for 30 seconds. I'm just going to hold this here. I'm going to take my Y connector, connect directly to my return side of the lumen, and I'm going to connect my bloodline to one of the 2 sides of the Y connector. Then I'm going to take, okay, we'll just say that my IV was still inside my swab. All right, I'm going to take the end of my IV line. I'm going to connect, oops, pardon me. I'm going to connect to the other side of my Y connector. Okay. All right. So I'm going to start by unclamping. I'm not going to unclamp my IV line just yet. I'm going to unclamp here on the Y connector on the blue side and the 2 blood lines. So I'm going to start my pump. I'm going to, once my dialysis blood pump is going, I'm going to start my Alaris pump. So I'm going to select my channel and I'm going to say start, and then I'm going to unclamp my IV line just to make sure there's some pressure in that line, because you might get a little bit of blood backing up into this IV line. All right, so you do have the option halfway through, so half an hour through, you could try reversing sides, in which case what you would do is your outer scrub of both sides, clamp, and you would literally, with gloves on of course, do a complete reversal and run through the other lumen and see if you can also clear out that lumen of any clots or fibrin sheath with the Alteplase running through. All right, good luck.